So colonoscopy is the best test that we have to find growths in the colon called polyps, some of which are precancerous. Those are called adenomas, to prevent colon cancer. However, with anything, there's always limitations, and probably one of our biggest challenges in colonoscopy today is surface area exposure. The colon itself is not a smooth tube. The colon has something we call folds. So there's a front side and a back side, and when we're advancing the camera to the end of the colon, we easily see the front side, but sometimes it's difficult to see the back side. And so over the years, there's been this effort to try to improve the surface area exposure during colonoscopy. And there have been optical techniques, and most recently, over the last several years, there's been an effort with mechanical enhancements. And one of these mechanical enhancements is the GI colonoscope. And the GI colonoscope is an integrated balloon that's permanently mounted on the end of the colonoscope. It's deflated when we insert the colonoscope to the end of the colon, which is the cecum. When the balloon is inflated at the cecum, the scope is slowly pulled back, and what the balloon is doing is it's engaging the colon wall, and it does it in a way to flatten those folds, so the colon does look temporarily smooth. And what that does is it allows the polyps that could potentially be hidden behind some of the folds or some of the blind spots, which are sharp turns in the colon, to be in our visual field. The other thing that it allows us to do is have stabilization, because what happens is the scope itself, the tip where the camera is in the center of that balloon. So it gives us the ability to have good surface area exposure, which leads us to see more of the colon wall, which allows us to find more polyps, especially precancerous polyps. And the clinical data has supported this. We've seen a 30% increase compared to standard colonoscopy. And we've also seen an 18% increase compared to other devices. But what we always try to do is to improve what we do. And when we think about colonoscopy, it is the best test we have, but there's an effort to try to improve the whole procedure.